Welcome friends. We are having in the continuity of the injuries that we are going through and a complete discussion. Now we will be having the discussion on the abdominal injuries and the injury to the pelvic organs. Generally, we have injuries in the abdomen that may be simple, that is a mild bruise or punching, or mild abrasion, sometimes bruise, migratory bruise, and even that can be stab wound also, that can be penetrating the abdomen, stomach, spleen, liver, sometimes back punch into the kidneys, and sometimes punching can lead to injuries in the mesentery, intestine, and various other forms of the abdominal injuries that we will be discussing today. And it is the duty of the examining doctor or the examining surgeon that he should be aware of that what are the different types of blunt forces that may be applied, or what are the different types of injuries that can happen to the blow or the uh, impact from different directions. We will be discussing everything in detail. Let's have the discussion going on. Damage to abdomen, generally blunt and penetrating trauma of the abdomen, depends upon the location of the injury. We will be seeing in the figures. Location of the injury is important, because if the location is in the right quadrant or the left quadrant, right half upper, left half upper, the underlying structures are different. So the underlying organs which are just below the injury can be different, and that the injury can be different. Anterior abdomen occupied by intestine mainly provides a target for perforation. Close or blunt injury to the abdomen is common from both accident and assault, road traffic accident or train accident, or assault by punching or kicking. Impact on abdomen by steering wheels, like the drivers having steering wheel injuries. Crushing injury to vehicles or between the vehicles and the walls. Sometimes the person is being pushed to the walls or comes between the two colliding vehicles. Sometimes railway accidents can compress a person. So chances are that there are many injuries in the abdomen, including intestine and the other organs. Mainly the crushing force is being provided by the anteriorly by the force, blunt force, and the posteriorly by the spine. So most of the things or times the intestine is being crushed between spine uh, and the crushing force. Trauma of abdomen, open or penetrating wound. The liver and spleen may bleed, lead to hemoperitoneume. The intestine and mesentery wound often being multiple. Since intestines is goes zigzag manner, so it is many time overlapping. If a penetrating wound is going, it can cause multiple entry and exit wound in the intestine, and that there can be bleeding or perforation or the effusion from various sites in single applied force. Stomach, it is being mainly protected by the rib cage, but there if it is from the lower side like this, from lower side, then chances are that the stomach may also be injured. Kidneys, sometimes they are being struck from the front or very hard force, or sometimes from the back. This is the surface anatomy. We can see there are the other structures we have discussed heart in the previous lectures. Liver is mostly lying the costal line under the rib cage. Stomach is also somewhat hidden between the rib cage. So most of the time the injuries of the abdomen do not or sometimes injuries of the abdomen do not affect the liver or the stomach, or liver or stomach being hidden by the rib cage. So it is most of the time saved. Duodenum is here, and it is the lumbar vertebra that is, if a vertebra is here and the force is applied here. So most of the time the intestines are being crushed between these two forces. Bruising of abdominal wall, very common, and this bruising can be in the skin or underlying muscle depending upon the force applied. Decreased bruise on the abdominal skin associated in some instances with surface abrasions. Kicks will usually leave scuffed abrasion if tangential, unless protected by clothing. Fingertip or knuckle bruises may be seen, especially in child abuse. In infant, bruises may be seen in the side of the abdomen, where in infants mainly we generally in battered baby syndrome, the bruises may be seen in the line of applied force in the abdomen, mainly in the fingertips can be seen, forcibly gripping the child and lift the child up, common in axillary line of the chest. So most of the child is picked up like this and may be squeezed like this. So the bruising can be present in the chest, in the axillary line, in the axilla and the line below it. These are the structures from we can be finding from the posterior aspect. Kidneys are lying just in the back. Then the liver is there. Spleen is there on the left side. Right side we have liver, lungs, kidneys on the both side, and the ureter. These are the structures that are generally lying to the posterior of the abdominal wall, and any punch or kick from the back can also impact on these structures. Blunt trauma. Extensive bleeding to the peritoneal cavity can be because of the blunt trauma, usually from rupture of solid viscous bleeding from the mesentery. Mesentery is the structure that holds the intestine together, and it has various arteries supplying it. So if a mesentery or this arterial structure is being hurt or damaged, then the chances are there it can lead to ischemia of the intestine, or it can lead to bleeding in the peritoneum, and a large amount of fluid can be collected in the abdomen. Sometimes patient may not know that there is a bleeding going on, and a large amount of bleeding is had happened, and person may land up in shock and die. Bruising or rupture of the abdomen and diaphragm. Another phenomena. Stomach is less vulnerable than the intestine, but may be lacerated by heavy blow in the upper abdomen, especially when the full of food or fluid. When their stomach is full, the chances are that when the stomach is full, then it may be lying somewhat below. So when it is below, then the injury or thrust to the abdomen can cause the injury to the stomach also. Intestine and mesentery, as I have already discussed, that damage in the may frequently damage in the abdominal trauma. Bruising of the gut, intravascular mesentery occur being crushed against the lumbar spine. Lumbar spines provide the counter force. One force is from the outside, and the lumbar spine being rigid, they provide the rigid force there, and the intestines are being crushed in between that. We will show in one of the diagram how it is being crushed. Abdomen and duodenum and jejunum are particularly vulnerable to transactions because these are being attached to the posterior aspect by a fibrous tissues, so they can be struck out or pulled out and can be transected depending, as we have discussed, there is a transection of aorta. So duodenum and jejunum can also be transection. If we go through the anatomy of the intestine, how they are being traveling, how they are being attached to the posterior wall. So we will be seeing that how this duodenum and jejunum can be pulled out from their attachments and can lead to transactions. Laceration of mesentery is not uncommon both in traffic accident and assault. It is common in traffic accident and assault and can lead to bleeding also. Bruising of the gut and its vascular mesentery crust against the prominent lumbar spine I have already discussed. So we will be seeing into it. This is the diagram which shows that if a heavy blow comes from the outside, the spine being the effective counter force providing, so the intestine or the mesentery is being crushed between these two forces and can lead to bleeding or bruising depending upon the amount of force being provided. Injury or rupture of intestine or mesentery in violent blow to the upper central abdomen because of a small size and thin abdominal wall, the infant duodenum is easily vulnerable. Infant duodenum is easily vulnerable to transaction or rupture. So, if a child is being brought to the emergency department and it is being complaining of some of the injury to the abdomen, then we should be very much suspicious about the injury to the duodenum and the other adjacent structures. Injury to the mesentery may damage local arteries, cause severe bleeding, thrombosis of the artery can lead further to ischemia or infarction of the bowel as a consequence. Perforation may be delayed for a day or two. So, these are the things that you can see. The perforation can be delayed due to later accumulation of the fluid and all that, but infarction can happen and that can lead to further decaying of the tissue and can lead to further perforation of the bowel and can lead to septicemia or peritonitis or septicemia. Colon and rectum is rarely injured unless the abdominal injury is gross. One well-known lesion in the rupture of the rectum or sigmoid by high pressure air hose. Sometimes the mischievous activities happens in the industries or the high pressure areas where some air blows can be just put on the somebody's rectal area, and that pressure is so high that it penetrates the anus and also penetrates or ruptures the rectum. We have as authors we have come across a case in the Aligarh region also, where we have seen that mild high pressure air entered into the rectum and caused perforation in the rectum and in the lower intestine, and the person ultimately died because of the peritonitis and the perforation and the peritonitis and later septicemia. So there are chances that rectum can be or the anal region can be damaged by the high pressure airflow or injury by the blunt force. Rupture of the spleen, very common, can be damaged either from impact or on its surface or from the traction on its pedicle. The spleen is being attached by a pedicle, that is the fibrous tissue. So if it is being attacked there, it can rupture or can be either damaged directly by the spleen structure. Rupture may be immediate or may be delayed if a large subcapsular. This spleen is basically within the capsule. If capsule is intact, bleeding is happening inside the capsule, then the chances are that the person can be asymptomatic for some time. But when the capsule is ruptured, whole of the blood which has already leaked come to the abdomen and forms a large amount of blood in the cavity, and person may land up in shock. So there may be a delayed hemorrhage and shock also in spleen ruptures. especially when the capsule rupture is delayed. This delay can last for a number of days or even weeks, depending upon the strength of the capsule and the amount of bleeding in the capsule. Enlarged spleen is found in some of the natural or abnormal diseases or the natural phenomena like in malaria, glandular fever or other infection. The spleen is enlarged, and at this moment if somebody strikes the person or gives a blunt force to the abdomen, then chances of rupture of his spleen is also increase. In olden days there used to be a dagger, a stiletto dagger, that was used to rupture the spleen in case of malaria, but it was also a somewhat lethal or somewhat very fatal treatment, but it was done in the olden days in the Roman time. Now it is totally most other diseases of malaria and other fevers are curable, so we don't go to that. This is the laceration of a spleen following a lower chest impact during a road traffic accident. So we can see there is a laceration. Okay, there is also a laceration here also. So complete laceration, the capsule is being and the pedicle is being there. So this can lead to very huge bleeding and can lead to shock. Rupture of liver, this is another area where we should be very much cautious. Rupture of a liver is very dangerous to the person's life. A person serious abdominal trauma, fall from height, crush injury between the two wagons, driver's impact on the rim or the center of the steering wheel, unrestrained passenger being thrown out, pedestrian sometimes being struck from a vehicle, secondary damage from being thrown from to the ground. So most of the time the liver injuries are generally in the road traffic accident or the blunt trauma because of the fist and other quarrel. This is the rupture of the liver, complete rupture in a high speed deceleration during traffic accident. Road traffic accidents are very much dangerous to the liver, and the gunshot wound that are especially of rifle are very much dangerous to the liver. They can cause multiple laceration to the liver, and very serious emergency problems can arise, and person may die because of this, because of the multiple hemorrhages or the laceration of the liver. We will be seeing it into the coming slides. That why the injuries of the abdomen and the laceration of the livers are very important. Liver laceration can be many types. There can be linear cracks in the liver, often in the convex upper surface. Liver is like sometimes it is this. So most of the time liver laceration can be in the convex frontal surface, that is on the frontal side. Superficial subcapsular tear. There is a capsule around the liver, so subcapsular tear can be there. Complete transaction of the organ we have already seen in the previous slide. So there are chances that liver cracks can happen in many ways. There are chances that liver cracks can happen inside the liver mass but not coming out to the surface. So we should be very much conscious, and we should go for ultrasonography or the CT scan in case of emergency, so that we can see the actual damage to the liver and proper remedial activities or remedial course can be adopted early. Surface laceration may extend deeply into the liver and may even appear on the opposite side. Internal tears may not communicate with the surface, sometime that I was already discussing. So internal tears sometimes may not come to the surface. Infants suffer liver damage from trauma. It is quite common phenomena. Liver tears can occur during process of birth. During birth traumas, liver laceration can happen. Kidneys, we have seen that kidneys are very much prone to the damage in the road traffic accident, impact mainly in the pedestrian, kicking. Somebody is lying and somebody is kicking on him or her, then chances of kidney damage there. Sometimes pedestrian injuries like crushing injuries, chances of kidney damage is there. Perirenal hemorrhages are more common because of the vessels around the kidney, especially the renal vessels and the other vessels which are supplying the kidney. So hemorrhages around the perirenal area can happen because of the kidney damage or the associated structures. So we should be very much clear in examining the person, the complaints of the person, and sometime if a person lands in the mortuary because of that, then we should be very much clear about how the kidneys are being placed, what are the structures around it, and how it is how the injury behaves. We should be very much clear in analyzing the event in the sequential manner. When a victim is lying on the ground, swinging boot can considerably enter the slightly raised arch between the ribs, margins of the hip, and there the kidney is situated. All grades of damage from comminuted pulping to the transaction or shallow surface laceration can happen anywhere. So we should be very much conscious on that, and we should be uh, having a proper orientation of it. This is one of the surgical classification of the injury to the kidney. Grade 1, kidney capsule is intact. Subcapsular hematoma means it is within the capsule. This is the capsule of the kidneys. So it is within the capsule. And then the grade 2 laceration, it is less than 1 centimeter. Hematoma has already enlarged. Then grade 3 lacerations greater than 1 centimeter. It is greater than 1 centimeter. Grade 4 laceration into the collecting system. These are the collecting systems of the kidney. Here the filtration or the urine is being filtered and collected and it comes through it. So it has reached to the collecting system. Then the grade 4, whole of the kidney is being somehow being pulped into multiple fractures or multiple rupture, and it can be seen that all the areas are being ruptured, and it can say avulsion of hilum also. It is the hilum part is this part where there all the structures are going inside the kidney or coming out. Similarly, in lungs, we have seen the hilum where all the structures are going either going inside the lung or coming out of the lung. So this can also be ruptured. Various injuries can happen depending upon how can imagine or how the things are being examined in the ultrasonography and other investigations. We have now the forensics people have another problem, which especially on the border areas we are having another problem is transportation of the various illegal substances by the human beings, and especially they are being stuffed to in our body or body packing or some of the mechanism in which it can be hidden in our sometimes in our abdominal cavities, so that we can pass through the border scanners and can transport the material, especially the illegal substances, to the other country. And mainly it is the alimentary canal or the orifices that are being used to carry these materials. Materials are found in alimentary system, both sometimes in the person is alive in the scanner, or some person may die because of that material in the autopsy. We should be very much clear or very much cautious about it. Disorder of the mental state, sometimes overeating, or sometimes people do some deviations in the sexual behavior, like inserting some of the material into the rectum. So in either way, either somebody is eating something or somebody is pushing something into the alimentary canal, that can all lead to certain substances into the alimentary canal, and we can find it or we can correct it depending upon the mental state, depending upon the intent of intake. So we can monitor it. Sometimes we can get foreign object in rectum, urethra, bladder, vagina. We have gone through extensive cases: potato, banana, bulb, carrots also. These are the cups we have discussed. We got in Aligarh also, the cup being inserted into the rectum. Deodorant bottle, one case was also reported here that deodorant bottle was being inserted. Beer bottle is very common in very western countries. These are being inserted into the rectum just for the recreational process, but we have another purpose to insert the foreign body into the alimentary canal. These are generally because of the deviation of the mind. Deviation of the mind for recreational purpose, especially the sexual desires. So we should be aware of these things going in the society, and patient may land up with these objects into the rectum, especially the bananas, carrot, bulb, and some of the bottles also. In recent years, smuggling of narcotic substance through ports that I was discussing, airport, has commonly been accomplished by body packing. Means some of the materials are being hidden in the body. In the body to transport across border. Drugs being concealed in condoms, swallowed or inserted in the rectum or vagina, so it can be passed through the scanners or the border. Death may occur by rupture of the condom. If somebody has taken heroin or something like that, cocaine, and took into and swallowed into the abdomen, and taken antidiarrheal pill, so that he or she may pass through the scanner and get defecate there and take out the drugs on the other side of the border. But sometimes these condoms or the other packing materials may rupture in the abdominal cavity. Then it can deliver a high dose in the intestine, and person may land up in the emergency department. So death may have occurred because of the package within the gut. So because of the rupture of the packet within the gut, and the massive dose of heroin and cocaine is released. So condoms, when go inside the digestive tract, they sometimes rupture also and can cause massive release of the dose. So we should be, as a custom officer or the medical officer at the airport, we should be aware of these things. Body packing phenomena is being very rampant in the border areas of the Mexico and other areas, where in the border areas of India and Sri Lanka. So we can be very much cautious there. Injuries to the pelvis and the pelvic organ, mostly because of the run over injuries. Dislocation can happen. Running over by vehicle wheel, the pelvic may be splayed, pelvic may be opened. Stamping in symphysis, parting apart. Sacroiliac joint becoming dislocated. Impact from side, if somebody is standing side from right side or left side. So shatter in the superior pubic ramus, inferior pubic ramus, dislocation of sacroiliac joint. So any of the injury which you can imagine can happen if there is an impact, and we should be very much aggressive in analyzing and visualizing the impact, that the direction of the injury, direction of the force, and the direction of the person standing or the person laying down, and we can visualize the injury that can happen. A fall from height onto the feet, sometimes we are not able to understand how the fall from height can lead to different injuries. A fall from height, sudden stopping of the person can lead to reverse phenomena of leaking, splaying of the or transmission of the force, even to drive on both femoral head to the acetabulum. Both femoral can push into the acetabulum. Pelvic girdle may crack. Sacroiliac joint may be sheared apart. A kick from very or heavy fall onto the base of the spine may fracture the coccyx or sacrum, or it can lead to the fracture of the foramen magnum or fracture around it like ring fracture. Sacro and scrotal or vulval injuries can happen falling from a stride object or a traffic accident. So various injuries can happen because of the fall. Spine can collapse because of the fall. Spine can crack also. There may be injuries in the head also because of the reverse transmission of the force through the spine and the underlying object. With this, we come to the conclusion of the regional injuries. Now, from the coming lectures, we will be having road traffic accident, transport injuries, and further we will be having discussion on the how we will be analyzing the injury, and how we will be preparing the reports, and how we will be preparing the reports, and how we will be presenting our reports to the court, and the examination, cross examination, the different things we will be having in coming lectures. So we should be prepared, and we will be having a good discussion in coming days. Thank you. Thanks a lot.